Thank you very much for the opportunity to speak, Representative Steinberg or Chairman Steinberg. I want to just take a moment, and I believe that this is important as we're having these conversations and we talk about things like vaccines being controversial or having controversial conversations about things related to vaccines. It's really important that we have read and understand the reasons why vaccines are perceived as controversial, because I believe that we are doing a disservice to public health as a community if we say that vaccines in and of themselves are controversial, when the main criticism is not that people don't have confidence in the science of vaccines. The main criticism is that people believe that it is a religious freedom issue that they're concerned about. And in a time of a global pandemic, I would just caution my colleagues to please not do anything that is a disservice to the confidence in our very advanced scientific system, in using language that suggests that people aren't confident in the efficacy and science behind vaccinations, because that is not true. And we rely wholeheartedly on confidence in vaccines for us to be able to battle this pandemic that we're facing as a nation. And so I just ask and I plead with you as my colleagues to please be judicious about the language that you're using related to vaccine confidence, because I think that if you are listening and hearing and reading the emails that I'm sure we're all getting, it is not a vaccine confidence issue for the vast majority of people. It is about the language of the bill and how they believe that that is related to. And I think that that is honestly the strongest partisan difference that we see across party aisles, is about responsibility of local versus state. And that's a great debate to have, a great discussion for us to have. But there's a resounding amount of scientific evidence about the efficacy of vaccines. And there's also a very strong body of scientific evidence in public support and confidence in the efficacy of vaccines. And if we undermine what is scientifically evident in our political discussions, we do a disservice to the community. And as elected officials, I think we just need to and should be judicious about the language that we choose to use. So thank you so much for giving me the opportunity to speak.